Thank you very much for inviting me to speak. I won't put my camera on because my battery's a little dodgy. So I'm going to be talking about some issues around vaccine uptake. I'm going to look at some vaccine uptake trends and consider why children are not vaccinated, and then look at some data about parents' attitudes to immunization. And then I'm going to consider the issue of vaccine uptake amongst people with disabilities, and finally just highlight some useful information about vaccines generally. So I just wanted to set the context, and I will be focusing mainly on measles. And the reason I'm focusing mainly on measles is because this is an extraordinarily infectious disease. And what we're seeing at the moment are outbreaks of measles around the world for various reasons. But the vaccine program, measles vaccine program, has been tremendously successful. So in 1963, before measles vaccines were widely introduced, there was something of the order of 2.5 million deaths every year from this infection, mainly in young children. Vaccines were introduced in the 60s, so the UK introduced a single measles vaccine in 1968, and by 2017, those deaths were down to 110,000, but still far too many in view of the fact that this is an incredibly effective, very cheap and very safe vaccine. So it's estimated that in the first 24 years of this century, that measles vaccination has prevented about 59 million deaths, making it one of the best buys in public health. But we still see deaths every year. And in 2024, there were more than 95,000 measles deaths globally, again, mostly in children under the age of 5, which amounts to about 260 deaths every day from this infection. So I'm just going to focus on vaccine uptake figures now, and I'm using the UK figures as an example. So in the UK, there are target uptakes for vaccines, which are 95%. And in the UK, for those vaccines given in the first year of life that David alluded to, the so-called 6-in-1, uptake is just below 92%. We see higher rates in the other UK countries, particularly in Scotland, they do very well. And what brings down the average in England is that uptake in London is very much poorer. So one of the districts in London, City and Hackney, has an uptake of only just over 60%. This is the lowest uptake in the country. And then for the measles, mumps and rubella vaccine, we don't have figures yet for measles, mumps, rubella and varicella because it's only just been introduced. The uptake in the UK as a whole and in England is below 90%. And for measles, as I mentioned, because it's so highly infectious, we need to have much higher uptake than that of 2 doses. And you can see that for the 2 doses at 5 years, uptake is very suboptimal. And in City and Hackney, again, only just over half the children at age 5 have had these 2 doses of measles, mumps, and rubella. So we're concerned about vaccine uptake, and if we go to any country, there have been declines in many countries in vaccine uptake. Recently in England, it goes way back to 2013, so over a decade ago, and this is largely because of major health reforms to the health system. Other countries have also seen declines in vaccine uptake, particularly during the pandemic, for reasons that you probably are very well aware of. And many of these countries have not fully recovered, so they've not got back to their former uptake, nor, importantly, have those children that weren't vaccinated been caught up with vaccines. So there are lots of reasons why uptake is in decline or poor. So during the pandemic, obviously vaccine services in many countries were affected directly with a diversion of resources and personnel to deal with the pandemic. And it's certainly true that there's been an increase in questions and concerns about vaccination since the pandemic. Now, I think this is a really good thing, but it does mean that we need to be thinking about how we deal with people's questions and concerns, so that they're having answers to them. You'll be well aware that there's a lot of mis and disinformation on social media. And certainly what we find in the UK is that some parents find it difficult to get answers to their questions from health professionals because there is a shortage of them, essentially. And in that absence of information for health professionals, people turn to the internet to answer their questions, where sometimes it's quite difficult for people to actually assess the quality of information. And we know there are lots of myths and rumours circulating. Many countries are now seeing pressures on health services, including the US. And in some countries, in the United States, there are particular issues ongoing, which mean that confidence in vaccination, should we say, is suffering a severe knock. Low uptake also goes hand in hand with poverty, which we see in the UK and many other countries. And one big issue is that vaccine programs over time, as you saw by those measles figures, have been incredibly successful. And what happens in that situation is the diseases go away. And people think, okay, it's fine, don't need to vaccinate any longer. And of course, as soon as people start thinking that, the diseases come back with a vengeance. So in thinking about those kind of issues, a very important factor in low vaccine uptake is difficulty that parents, the public, people have in accessing it. And this is just the headlines from a report that was conducted by the Royal College of Paediatrics and Child Health in the UK last year, where they concluded that vaccine confidence is very high, but under-vaccination is more often due to difficulties accessing services, and there might be lots of practical and logistical reasons making it difficult for families. So poverty is one. People have competing priorities. Pressure on health services mean that clinic times might be very limited, making it difficult for parents, working parents, or parents with a number of children to access those appointments. So these are really important factors that can actually place a barrier. So if those barriers along with uncertainty about whether to have a child vaccinated as well, it can be quite a problem, and it can mean that parents don't actively pursue immunization for their children. So just turning to what parents say about vaccination, and you can see from those uptake figures that most parents do have their children vaccinated. This is the norm, and they recognize it to be important. So in various studies, we find that well over 90% of parents say childhood vaccines are important for my children's health. They agree that vaccines are safe, and most parents do vaccinate automatically or after they've weighed up the pros and cons of vaccination. It's actually a really small minority of parents, probably of the order of 1 or 2%, who refuse everything. So the norm is for people to have their children vaccinated. However, people are on a what they call a vaccine acceptance continuum. So at one end, you have parents who are the norm, who tend to accept vaccination. This is the majority of parents. Their children are usually fully immunized. They trust their vaccine provider. While at the other end are parents who reject vaccination. And as I mentioned, that's about 1%. So their children are not immunized. There's low trust in vaccine providers, no interest in having a conversation. And then in the middle, we have a group of parents who are called hesitant. And this is just as its name applies. They're unsure about it. They don't know what to do. They might delay or choose only some vaccines. And what they often want is just simply to have a conversation with somebody they trust, a healthcare provider. They're interested in having that sort of information. And this conversation, which is not always easy for some parents to have, to access, is all important because it can make people who might not vaccinate their children change their minds. So here I've got a list of some of the questions that parents have about vaccination. They're very predictable. They come up time and time again. Top of the list will always be about the safety of the vaccine. Parents sometimes worry about their children having a lot of vaccines at once and might ask them to be spaced out, have them separately, that sort of thing. Parents may worry about very young, perhaps premature, very low birth weight babies being vaccinated very early because they consider them to be too small or delicate, when in fact that's exactly the time they should be vaccinated because they're most vulnerable to infections. Some parents believe their healthy lifestyle will protect the child, but we would always argue that vaccination is important as well as a healthy lifestyle. And then, as I mentioned before, parents who haven't heard of the vaccines or the diseases even because they weren't around when they were young or the diseases have gone away. And then there will be other issues about particular vaccines like with COVID vaccine. So many people had the vaccine but still caught COVID. And the idea, of course, we now know, we're very clear about COVID vaccine is that it doesn't necessarily stop transmission, but it does stop people getting seriously ill and dying. And of course, people might apply those principles to other vaccines, but other vaccines work in a different way. So if you're fully immunized against measles, you will be immune. You will be protected against the infection. And if you catch it, it will be very, very much milder. And then there's concern about the content of vaccines. So lots of different questions, which I don't have time to look at the answers to now, but we can discuss later if necessary. So just turning to what's happened. Now, I mentioned that measles reemerges when vaccine levels are low. And you can see here, these are confirmed cases of measles in England and Wales. And we had largest number of measles cases for many, many years in 2024, just under 3,000. And here we are in 2026, and we're going up very rapidly. And there are measles outbreaks globally. So here I have listed the top 10 countries with measles outbreaks in 2024. I mentioned there were 95,000 deaths globally from measles in 2024, and you can see the countries listed there with India, Yemen, Pakistan up high up the list. In the United States, they eliminated measles completely in the year 2000, but now measles is coming back. It's making a grip because of reduced vaccine uptake, and there were 3 deaths in 2024. Canada's seen 5,000 cases, and in 2024 in the European region of the WHO, there were over 100,000 cases with 38 deaths. So measles is often described as being the canary in the coal mine. And what that means is, because it is high infectivity of the infection, it's usually the first disease to reappear when vaccine levels start falling. And obviously that's what we're seeing now. So it's a real early warning system. So just looking at what we know about which particular children are at risk of not being vaccinated, this is a great long list of different children. This is produced by the National Institute for Health and Care Excellence in the UK, but will apply in many different settings. And I won't go through them all, but you can see that at the top of the list are children or babies who are hospitalized or have a chronic illness and their siblings. And then next to that, people with physical or learning disabilities. Now, unfortunately, perhaps it'll come as no surprise to you, this is a pretty much under-researched area about why this is. We know that this happens, but the reasons for this are much less well researched. Trying to move the slides on, don't move. And this is a review conducted by some researchers for Australia, and they looked at they brought together all the research that had been done about vaccination in people with a disability. And they said quite rightly that people with disabilities are vulnerable to the complications from vaccine preventable diseases. And UNICEF has highlighted that the large inequity in access to immunization for children, young people and adults with disabilities. And this obviously has a subsequent impact on their health and well-being. So not only do they have inequitable access to health services, but often exclusion from any particular initiatives around improving uptake of vaccination. And there may also be a lack of understanding of the safety of immunisation for those with an underlying disability among both healthcare professionals, but also amongst parents and patients. And some of the predictors of children with disabilities actually becoming immunised were there was more likelihood if they had regular health checks, but also, and this applies across the board, this is for children with disabilities, but children without disabilities too, is that a recommendation to immunise by a healthcare provider is an incredibly powerful motivator. And we know that many, many people will have their children immunised as a result of that. But I would emphasise that there is a need to advocate for further research in this area amongst children with disabilities to look more closely at the reasons why they're not vaccinated. So just drawing this to a close, just to highlight the importance of having vaccine conversations with healthcare professionals when there is doubt or hesitation about being vaccinated. And we know that information from a well-informed healthcare professional can be very influential in vaccine decision making. It can encourage somebody who previously was very hesitant or even wasn't going to have their child vaccinated at all decide that they're going to vaccinate. So it's about discussing their concerns and questions and responding appropriately. So just finally touching on a study from the UK, which found that actually when they looked at vaccine uptake with children with an intellectual disability and compared that uptake with the general population, they didn't actually find any difference in vaccine uptake between the two groups, with the exception of measles, mumps and rubella vaccine. Now, I must emphasize that this study was conducted way back in 2000. These babies that they were looking at were born in 2000, which was very, very soon after the controversy about MMR began. And the reasons that parents gave for not having their children vaccinated was parental choice, because they were scared of the possible implications of being vaccinated. Now, I just finally wanted to flag up this extremely useful website. This is part of the Oxford Vaccine Group. So this is the group that developed the first COVID vaccine, and they do a lot of vaccine research. And they have something called the Vaccine Knowledge Project, which is a website with many questions and answers and information about vaccines and infectious diseases and vaccine safety. It's all independently produced by experts, and they have a facility to translate the language translate the information on the screen into a number of languages. So it's a really incredibly useful resource for parents and the public, but also for health professionals. Thank you very much.